ESC TV. My name is Joep Perk. I come from the Linnaeus University in Kalmar, Sweden, and my honored guest is Professor Christi Deaton from Cambridge University, Professor of Nursing Sciences. Christi, this huge, enormous conference, you have already been going to some of the lectures and you were quite excited about one of the lectures you heard this morning. Tell me.
Yes, I was. I think it emphasizes the importance of looking at cardiovascular disease in a global manner, and that we can apply what we've learned in Western Europe to other countries. I heard a very interesting talk this morning. We were talking about, it was all about diet, but Salim Yusuf emphasized the importance of, we have to look at food in its cultural and societal place, and a fruit is not a fruit depending on where you are, and the cost of food is very important. Some people in some countries may spend 60% of their income on food, and so you can't ask them to buy more fruit and vegetables.
So that shows that the challenge for prevention differs enormously in different parts of the world. So writing guidelines for the rest of the world will be quite difficult. You really have to adapt it to local levels, isn't that so?
It is true. We certainly have to consider all of those considerations. But you mentioned guidelines, and I think that's an important area. We know that our guidelines are the recommendations for the best care for patients. We want them to be implemented. And there's been I went to another interesting session about how nurses and allied health professionals, what their role is in implementing guidelines. And the message there was that implementing guidelines is everyone's responsibility. And we should have those discussions to make sure that patients are getting the best care.
Well, with our interest in the third world at the moment, are there no challenges left in our old European world? I'm thinking about the old population in Europe. We are getting more and more people of advanced age. And I heard this morning an excellent presentation where they showed that pretty soon 3 out of 4 of the people above the age of 70 will have hypertension. And is there a role for nurses there to help us to deliver care, because it's obviously not working as we need to get it working?
Well, I certainly think delivering health care is multi-professional, but I think there were some issues around who we treat and to what extent we treat them. And you saw a trial about that, didn't you?
Yes, I did. And what we saw there is one material that came from Taiwan on the effect of proper care for hypertension for the elderly. If you do that, the gain you make on less stroke is impressive. So there is a real challenge even left in old Europe. Now, we are still at the beginning of the Congress, so there are so many sessions. Where are you rushing off to in the first place then?
Well, there's some that I'm really excited about, and obviously there's been a lot of controversy about the cutoffs for lipid therapy and what the recommendations are for lipid lowering. So that's going to be a very interesting discussion between the U.S. and European investigators. But then I'm also very interested in how we get people to do things. And so we know exercise is a very effective therapy for many of our patients, but does it really work in the real world? Can we make that an intervention that's effective in the real world? So that's going to be a very interesting presentation.
Well, I'm certain that session I will keep you company. Thank you for coming to this session, and thank you for being available on ESC TV. Thank you very much.
Thank you, Joep.